Hi, my name is Laura Fout, and this is my video submission for physical assessment for Health Assessment 1 for UALR. The first thing I do when I enter a patient's room is always wash my hands to prevent the spread of infection, then of course introduce myself to my patient. Hi, I'm Laura. I'm going to be your nurse today.
Hi, I'm Josh Fout. Please call me Josh.
I sure will, Josh. Today we're going to be doing head-to assessment. It should take about 20-25 minutes. I'm going to shut this door over here and drape you to provide for privacy. And of course, this is a confidential session, but if you have any questions, please feel free to ask me along the way.
Okay.
The first thing I'm going to do is assess Josh's level of consciousness. I'm going to ask him his name.
Josh Fout.
And do you know where you are today?
I'm at the clinic.
Perfect. And do you know what day of the week it is?
It's Wednesday.
Great. Next, we're going to review Josh's vital signs. His temperature is 98.4, heart rate 74, respiratory rate 16, blood pressure 134/81. And are you currently in any pain?
No.
Okay, great. So all of his vital signs have been assessed and they're all within normal range. The next thing we're going to do is take a look at his skin. We're going to be looking at, of course, at first with the face, the color and uniformity. It's pink and uniform in color, free of lesions and no obvious tattoos in the facial area. The next thing we're going to do is feel the skin. The skin is neither dry nor moist, and I'm also going to assess temperature bilaterally. I don't feel any lumps or bumps or anything like that. So next I'm going to feel the skull. The skull is symmetrical, and I do feel some bony prominences, but those are normal. So the head is normal cephalic. Next thing we're going to do is take a look at the hair. The hair is well evenly distributed. It's brown in color and fine in texture and rather straight. We don't have any signs of dandruff or parasitic infestation. At the same time that we're looking at the hair, we're also assessing the scalp. The scalp is free of lesions and uniform in color. Okay. Now, the next hair that we have to assess for Josh is the beard. The beard is, his beard is more thick in texture and curly. It's brown in color, and the skin underneath is neither excessively moist nor dry, and uniform in color. No signs of parasitic infestation. Okay, the next thing that we're going to be doing is taking a look at Josh and his facial features. The eyes are in the top third of the head. The mouth is in the bottom third aspect of the head. The nose is straight in midline. Okay, next we're going to be assessing the trigeminal nerve. So if I'll ask you to please close your eyes, and I'm going to rub this cotton ball on your face, and you tell me where you feel it and what side of your face. That'd be great.
Left forehead. Right forehead. Right cheek.
Great.
Left cheek. Right jaw. Left jaw.
Okay, great. Another way to assess the trigeminal nerve would be to place your hands on the temporal muscles and have the patient clench their jaw. Will you please clench your jaw and release? And also the masseter muscles, and please clench and release. Great. So the contraction of those muscles was equal and bilaterally strong, so that indicates that we do have an intact trigeminal nerve. Now, the next thing we're going to do is assess his facial nerves. So if you'll raise your eyebrows for me, down, and smile, and release, and puff your cheeks out. Great. Close your eyes. I'm going to try to pry them open, but you don't let me. There you go. Great. So all of those actions indicate we have intact facial nerve because we're not able to open the eyes, and all facial expressions were symmetrical, no drooping. Next, we're going to be looking at the eyes. The eyebrows are evenly distributed and full across the whole width of the eyes. The eyelashes are everted and on the top lid and bottom lid. I'm going to be assessing the optic nerve next. I'm going to have Josh look at the Snellen eye chart on the wall. Now, if you cover your left eye, please. And read to me the last line that you can read clearly.
O-N-D-G.
Okay, and cover your other eye.
O-N-D-G.
Okay, great. Now, and can you tell me what the color the bar on top is?
Green.
And the bar on bottom?
Red.
Great. So we've determined that Josh has intact optic nerve. The line he was able to read was on 20, which indicates that he has 20/20 vision. Do you wear any corrective lenses?
No.
Okay. The next thing we're going to be assessing is the ocular motor, the trochlear, and the abducens nerves. Now, the way we do this is we have a patient look straight ahead, and if you would please follow my finger. Okay, and his eyes exhibited full range of motion without nystagmus, and that indicates that those nerves are intact. The next thing we're going to be looking at is the eyes themselves, particularly the pupil area. His pupils are round, dark, and equal in diameter, and appropriate size. Next, I'm going to shine a bright light towards your eye, so just look straight ahead. Now, as I shine this light towards Josh's eye, that pupil that the light is going toward directly constricts, and the other opposite eye consensually constricts equally on the other side. Okay, so we can now say that Josh's pupils are equally round and reactive to light. Now, if you'll please look at my finger. Now look at the wall over there. Now look back to my finger and back to the wall and back to my finger. Okay, as Josh's eyes focus on my finger, both pupils constrict, and as he looks at the wall, they dilate. So that is called accommodation. So his eyes are perla, is how we would chart that. So the next thing that I'm going to be looking at is Josh's ears. They are symmetrical and aligned with the palpable fissure of his eye. So they're appropriately placed. The skin is uniform and pink. And you tell me if you feel any tenderness. So there's no tenderness. You don't feel any tenderness?
No.
Of the auricle, of the tragus, and of the mastoid process. I'm going to be looking in your ear, in your outer canal, and there's no evidence of foreign bodies, but just a little bit of cerumen, which is normal. If I had an otoscope, I would be looking for the tympanic membrane, the shiny, kind of pearly looking surface that's nice and taut with a nice bright spot of light shining back at me to indicate that everything's intact. The next thing that I'm going to do is assess his vestibulocochlear nerve. Vestibulocochlear nerve. So, if you would, I'm going to whisper something to you, and you tell me what, if you'll cover this ear, you tell me what you hear.
Batman.
And again on this side?
Robin.
Great. Okay, so he was able to tell us what that was, so we can indicate that he does have an intact vestibulocochlear nerve. Okay. All right, next I'm going to be looking at the nose. It's nice and midline. Let me take a look inside here. And we do have a slight deviation. If you'll include one side and take a breath in and out. And on the other side and out. Okay, so we do have patent nerves bilateral. If we were assessing for olfactory nerve, we could have him repeat that same test. We will just put a scented item under the nose, something like coffee or cinnamon, and he would identify the scent to confirm that that was intact. The next thing that we're going to be looking at is the mouth. His lips are symmetrical and moist, pink, no crackling or lesions. Now if you'll just open your mouth for me, I'm going to be taking a look at your buccal mucosa. It's nice and smooth, pink and even, free of lesions. Get out my tongue blade here. All right. No, keep your tongue in. Just open your mouth, please. Thank you. Okay, I'm just taking a look at your teeth. And your teeth are all present and white and good repair. You don't wear any appliances in your mouth?
No.
Okay. And I'm going to be looking at your gums. Your gingiva is very light pink and smooth and free of lesions. I don't see any edema or bleeding, anything like that. I'm going to look up at the top and your soft and your hard palate. Your soft palate is pink and your hard palate is paler. They're both intact. The hard palate does have vertical rugae present. Go ahead and put your tongue out for me and say ah.
Ah.
Okay. Now, the uvula is midline on phonotation, so his glossopharyngeal and vagus nerves are intact because that looks nice and symmetrical back there. If you'll also just protrude your tongue out, good. So the hypoglossus nerve is intact because it's able to put that tongue out. The surface of the tongue, let me take a look at that. Let's see, we've got some rough pathway on there. I'm going to take a look at the ventral aspect of the tongue, and it is moist and pink and has veins present. Okay. All right. Now I'm going to be looking at your neck. So first I just look at the neck, inspect the skin, make sure everything looks symmetrical. All right. Now if you'll just please put some resistance against my hand. Just keep your shoulders straight and just your head. There we go. And on this side, great. Now here, press that. Perfect. Okay, so your trapezius and sternemastoid muscles are able to resist against my hand. So that means that he has a good intact spinal accessory nerve. Now I'm just going to be palpating around for his lymph node chains. So I'm going to do pre-auricular, post-auricular, tonsillar, submandibular, submental, occipital, superficial cervical, deep cervical, posterior cervical, and subclavicular. Okay, I'm going to feel one at a time for the carotid arteries. Okay, and they are palpable. And if I had a bell stethoscope, I would listen with my bell to listen for any bruits. And I don't hear any bruits. That would be specifically an issue with patients with arteriosclerosis. Okay, next I'm going to be looking at the thorax, and he's chosen to keep his shirt on during this assessment. So what I would be looking for is just a general skin assessment to make sure the skin is intact and the coloration even. And also on the back, taking a look, everything looks nice and symmetrical. I would be looking for the anterior to posterior transverse diameter. 1 to 2 is the ratio that we look for that. Now I want you to go ahead and repeat the words 99 for me.
99. 99. 99. 99. 99.
Great. Can I put you in front here?
99.
Uh-huh.
99. 99. 99.
Okay. I was palpating for my tactile frenulus, and now I'm going to be feeling for chest expansion. You'll take a deep breath for me. And out. And in. And out. Okay. Take a look at our spine. It's S-shaped. No problems there. Okay, now I'm going to be percussing. We should feel resonant sounds over lung fields. And dull sounds over viscera and diaphragm. Okay, now I'm going to be taking a listen to your lung sounds, okay? So first I'm going to listen to, I want you to take a deep breath each time that I touch you in this different place with the stethoscope. Go take a nice deep breath for me. Alright. You feeling okay? Getting lightheaded yet?
No, I'm okay.
Alright. Okay. So I hear vesicular breath sounds in all your peripheral lung fields. I don't hear any adventitious sounds. Everything sounds clear to auscultation bilaterally, so that's all great. The next thing I'm going to be listening for is your heart sounds. So before I start to listen, I'm going to actually do the landmarking. So I'm going to feel for the sternum, and I'm going to find the left and right sternal borders. I'm also going to be feeling for the intercostal spaces and the mid-clavicular line. Now that I have my landmarks, I can start to listen to the heart sounds. The aortic heart sound is going to be on the left. Sorry, the aortic is on his right, the right sternal border at the second intercostal space. Okay. Sounds very good. Pulmonic is also at the second intercostal space, but on the left sternal border. The third intercostal space, left sternal border, is Erb's point. The tricuspid valve is at the fifth intercostal space at the left sternal border, and the mitral valve, the mid-clavicular line. Okay, so I hear regular rate and a rhythm, an S1 and S2 present, no adventitious or extra heart sounds, no murmurs or anything like that. So all of that sounds great. Now for breast assessment, what I would be looking for is changes in coloration and texture of the skin surrounding the nipple area. I'll also have the patient position in more of a supine position. And feeling for the axillary nodes, I'll work my way in towards the breast tissue. And I just go in a systematic vertical up and down motion across the breast tissue. I'm going to do that on both sides. And I don't feel any lumps or nodes. And I'm assessing for any tenderness in this area. Okay, great. All right, go ahead and sit up. Okay, the next thing that I'm going to be looking at is peripheral vascular system and extremities. So I'm going to be taking a look at the skin of the arms and noting any signs of lesions or skin breakdown. I'm also looking for tattoos, which are present, and I'm also feeling for temperature changes and looking for hair distribution. I'm going to be feeling for any signs of edema, which I don't have any, and I'm also going to be looking for cap refill, which is less than 3 seconds. The nail beds are clear and convex and no clubbing present. Everything looks to be intact. I'm going to do the same. Feel any tenderness in your calf muscle here?
No.
And still inspecting the skin all the way down. Palpating for edema. Okay, we've got 3-second cap refill, the skin of the toes. Now, we can feel brachial pulses bilaterally, and they're equal bounding 2+. So that's exactly what you want. Okay, and it's equal and 2+. And I'll do popliteal. And we'll do the post-tibial. And we'll do pedal pulses. And both of those pulses are 2+. All right, so we've made it to the end. Thank you very much.
Thanks.